Good evening all. Myself Dr.A.Vaniprabha, Associate Professor, EC Department, SNS College of Engineering. Today I am going to share you few applications of electromagnetic fields. First, let's see what an electromagnetic field is. It is a combination of invisible electric and magnetic fields of force. They are generated by naturally, like Earth's magnetic field, also by human activities, mainly through the use of electricity. The combination of electric and magnetic fields are employed in many applications. Right now, we'll see the applications of EMF in medicine. So, this EMF, electromagnetic fields, are employed in diagnostic imaging. Applications involving heat generating RF waves are used for therapeutic purposes. The three main applications of EMF in the areas of medicine are MRI, RF ablation, localized dielectric heating. Let's see one by one in detail. So first we'll look into magnetic resonance imaging, shortly named as MRI. MRI is a medical imaging technique used in radiology to visualize internal structures or organs. An MRI unit produces three different EMF fields to generate the images. A static magnetic field of zero frequency, average magnetic flux of density 1.5 to 3 Tesla, is produced by a large magnet for alignment of nuclei inside the body. Low power time varying magnetic field gradients in the order of 100 Hz to 1 kHz are generated by small magnets in three orthogonal planes, namely X, Y, and Z, provides the spatial movement of the protons. Further, these MF gradients also allow image slices to be created by focusing on the patient body part which is under examination. RF fields between 100 to 200 MHz produced in the non-radiative near field of the emitter to excite the protons and cause the protons to emit radio waves for the acquisition of anatomical images. So second one is radio frequency ablation. Radio frequency ablation procedures in medicine are mainly used in cardiology for the treatment of cardiac disorders and in oncology for tumor treatment. For interventional cardiology, RFA is a minimally invasive medical procedure used to correct irregular heart rhythms. The RF device consists of an ablator, RF generator, and a control console. The ablator is otherwise named as catheter. The energy emitting probe, that is the electrode, is at the tip of the catheter, which is inserted through very large veins into the heart. Ablation involves destroying small diseased parts of heart muscle by means of the resistive heat due to the electric current generated by high frequency waves in the catheter. This is also used to treat tumors in lung, liver, kidney, and bone, but with a generator at higher power than used for cardiology purposes. A small needle-like RFA probe is placed inside the tumor. RF waves passing through the probe increase the temperature within tumor tissue and thus it destructs the tumor tissue. RFA may be combined with locally delivered chemotherapy treatment and it is of particular value in reducing the size of inoperable tumors. RFA is mainly invasive and repeated procedures can be done with few complications when performed under radiological guidance. The last one is shortwave diathermy, called localized dielectric heating. This is the therapeutic application of high frequency AC used in physiotherapy treatments. RF fields are used to speed up the heating of tissues by providing deep heat into the large area of the body positioned on the conductance plates. Continuous short-wave diathermy is the technique of choice when heating of deep tissue is required. This also allows superficial structures to be heated selectively by means of various surface heating techniques. Subacute or chronic conditions respond best to continuous short-wave diathermy. Diathermy is used to relieve pain and muscle spasm, resolve inflammation, reduce swelling, increase joint range, and decrease joint stiffness. Measurements made of RF fields close to diathermy equipment show that for continuous wave shortwave equipment recommended ICNRP, whole body levels were exceeded 0.5 to 1 meter from the electrodes and cables. This distance was reduced to 0.5 meters for microwave units and pulsed shortwave diathermy models. Next, we'll see about the electromagnetics linked medicine to robotics. So today, there are countless uses for electromagnets, such as the application of electromagnets in industrial robotics, which is closely linked to medicine. Electromagnets integrate medicine and robotics using the tools of a surgeon, such as an eye surgeon, who can extract steel pieces from patient's eye with an electromagnet, increasing the current until he pulls enough to gently remove the metal. Also in microsurgery, researchers are working on electromagnets that can move micro robots around the body to perform the surgery without opening the patient. Electromagnets are devices that work because an electric current produces a magnetic field, and if a wire carrying an electric current is formed in a series of loops, the magnetic field can concentrate inside the loops. Thank you.